Lipo 360 kind of involves doing a liposuction kind of circumferentially around your torso. Obviously, the exception of your breast, but for the most part, from kind of armpit side all the way around on the back, all the way on the front, the abdomen, the flanks. Sometimes we'll include the upper hips on it too, depending on what they look like is what we're doing. But you always got to remember with Lipo 360 or any liposuction, all we're doing is just removing fat. If there is a redundancy of skin already there, a loose hanging skin or stretch mark skin, this is kind of an area that won't respond very well to the liposuction, because it's going to be, you will remove the fat, but if you think of it, it was a lot longer length from when the fat was there. Now that skin is still left there, the connective tissue that held the fat is still there, but the fat's gone, so it just bunches up.
Okay.
So when we're looking to do something like that, take a deep breath for me, let it out. Okay, good. So the areas that will help can respond and get some treatment would be kind of in the flank areas right here.
Okay.
Because of some thickness. We don't have much left here, but down in the flanks where everything got lifted up, this is now showing this, you do have some response that will be in the lower abdomen area. What I'm a little bit of concern about is right here in this upper abdomen. Might be a children? Okay, so you have a little bit of what's called the Diastasis recti, where the muscles have kind of spread apart. You also have a little bit of what's called visceral fat, which is an internal layer of fat. The problem with this is that you can imagine that if you're trying to do liposuction, say like if you have like a curve like a basketball, and here's your layer of fat. If you remove that fat, it still has that curve there. So that's what you have here going right now. Because of the looseness of the abdomen as well as that internal visceral fat, with liposuction, you're still going to see that curve.
Okay.
So that doesn't help as much when we're trying to have a certain look. But you do have a area. Liposuction will help some of this because you do have more here. So the flanks and this part being done in the lower abdomen will see improvements there.
Okay.
But is this going to be enough of an improvement for you that you're going to be happy with? That's what I tell patients is that we can get responses and we can do some areas and we'll see differences.
Okay.
But the looseness that's done because of the abdominal wall, or the looseness when we see stretch mark skin, might not give as much response as you're looking for.
But if you do that, once I like exercise and stuff, that'll kind of bring it down some more.
Well, yes. The more weight loss you have, the more that visceral fat will be gone.
Okay.
So at some point in time, what will happen though is that you probably will say, I still see it curving, we need to repair that muscle wall and do a tummy tuck at that point. That's when we'll do that, and that's when you start to see much more of that flat stomach. Until then, it won't be done. And I also tell patients many times when they are a candidate for a tummy tuck, or they're thinking about doing a tummy tuck, if they have a lot of visceral fat, the problem is that if we try and do that procedure before that visceral fat is gone, I can't repair the muscles as well. So instead of being straight up and down like this, they still have a little bit of a curve right here. So they'll end up with a bulge. They lose that fat afterwards. They still have that gap is still there. So we still have to repair that later on. So I try to encourage a lot of times with patients that you might want to have some weight loss if you want to have that better result.
Okay.
In your case, we can get some response and some results to where you will see a slimmer waistline.
And I'm okay with that.
And have some improvements there. But you do have some redundancy of skin. You still have that visceral fat there that won't give you if we're looking for that tiny little waist, we're not going to get that.
I'm fine with that. As long as I can do it a little bit more extra, I'm okay with that.
Okay.